Afternoon, I'm Steve Rissman. I'm the program chair for the Workers' Compensation Educational Conference, and today I'd like to talk to you about a couple of parts of the program. The Workers' Compensation Educational Conference is scheduled from August 6th through August 9th, 2017, and is at the Orlando World Marriott Center. It's the largest gathering of workers' compensation professionals in the country. Approximately 8,000 or 9,000 people will attend the convention. Professionals from every area will attend. The program is very substantive with over 500 speakers and approximately 180 sessions. There's something for everybody. Every single type of workers' compensation professional will benefit from attending the convention. And if you're involved in workers' compensation, this is your place to be. Let me go over a couple of the highlights for the convention. The sports keynote speaker this year is Derek Brooks, the legendary linebacker for FSU and the Hall of Famer for the Tampa Bay Bucks. The entertainment this year is Gavin DeGraw, the multi-platinum selling singer. One of the best attended and most interesting portions of the convention takes place on Tuesday. It's the live surgery presentation. This year we have Dr. Michael Riggenbach from Orlando Orthopaedic Center who will be performing wrist surgery. Welcome, Dr. Riggenbach.
Thank you for having me. I'm excited this year to be performing a live surgery at the workers' compensation event.
Thanks, Doc. First, let's talk a little bit about you. Tell us a little bit about your education and background.
I grew up in Ohio, went to school mostly in Ohio. Starting in college, I went to the University of Dayton in Dayton, Ohio. Finished med school at Wright State University and also in Dayton. I did my orthopedic residency at Ohio State University in Columbus, Ohio. And then introduced myself to Florida when I came to Gainesville to do my fellowship at University of Florida. And I came to Orlando in 2012, and I've been at the Orlando Orthopedic Center ever since.
What kind of surgery are you going to be doing for us at the convention, Doc?
We're going to be doing a wrist surgery, and that's kind of a vague term, but wrist injury, which is hopefully a scaphoid ligament injury and TFCC repair based upon arthroscopy findings.
So when you say arthroscopy findings, the symptoms that a patient would present with would look like what?
Usually it's wrist pain, oftentimes from a specific injury, usually accompanied with global pain, sometimes pain on the ulnar side or the small finger side of the wrist, pain with weight bearing, with gripping and lifting, and oftentimes prevents them from doing exercises like push-ups, their work, even caring for themselves on a daily basis.
I assume most of them don't want to do push-ups anyway, right?
Most of them, correct.
What determines whether the patient is surgical with an injury like this?
Depend on their symptoms, MRI findings. Sometimes they'll see a complete tear that's symptomatic for a patient, and then oftentimes that'll be a surgical indication. If they failed injections or physical therapy, that's also another indication for surgery.
Okay. Tell me a little bit about the surgery itself.
Initially, I do an arthroscopy where I usually confirm or diagnose a ligament tear in the wrist. Once that's confirmed, I oftentimes will make an incision on the back of the wrist. It's a few centimeters in length, and then we'll localize the area of concern. If the ligament is not repairable, which oftentimes is not, we'll do a reconstructive procedure where we use two anchors in the bone and a tendon graft from the wrist to help recreate that ligament.
Most of our audience, Doctor, will be adjusters, lawyers, and nurse case managers, and a lot of what they're interested in has to do with how soon somebody can go back to work. So our terms for that are temporary total and temporary partial disability. Temporary partial has to do with light duty work. So typically, how long would you keep a patient off work completely after the surgical procedure?
We usually keep patients off approximately 2 weeks completely from work until they see them maybe their first post-operative visit. If their pain is fairly well tolerated, they can go back to a light duty capacity if it's a desk type job or no use of that arm for the next 4 to 6 weeks.
So it'd be about 4 to 6 weeks of light duty. If the person, how about if the person worked in a factory, or the person worked in the tourist industry?
If they're heavily dependent upon use of that arm, they may be out of work for a period of 6 weeks before going back to work to some capacity. Usually a full return to work is approximately 3 to 6 months for this kind of an injury.
Okay, so I guess that puts us at our next question. What's the typical period of time from the date that you do the surgery for them to reach a plateau of maximum medical improvement?
Usually anywhere from 6 to 10 months, depending on how fast they recover with therapy.
6 to 10 months, so they're back at work after 6 or 8 weeks in all probability, but it may take upwards from 6 to 10 months for them to reach a plateau of maximum medical improvement.
Sure. Usually, there's a return to work with some still limitations, returning of strength by about the 2 to 3 month mark. If they're a laborer, it's going to be closer to the 3 to 4 month mark before they're even going back to work. And then usually they're plateauing in strength and range of motion by the 4 to 6 month mark. I've had some stretch it out to 8 to 10 months.
Is there a permanent impairment rating that's appropriate for this surgery?
Usually 2% or less is appropriate.
And how about permanent restrictions? After the surgery, assuming the surgery is reasonably successful, what permanent restrictions would somebody have?
There shouldn't be any.
Doctor, how do you think it benefits employers and adjusters and lawyers to actually see the surgery performed, what we call live surgery at the convention? How do you think it benefits them?
I think it benefits them in a couple of ways. I think number one, they get an appreciation of what we do in the operating room. Few people get to step into the operating room not as a patient and see that. So I think in a live fashion they can see the tools we use, the experience that we have, and the procedures and how they occur. They can get a better appreciation for the patient's procedure and their recovery process. I think it also adds a humanizing touch to the situation, a personalized touch, so they can understand going forward, both from the patient's perspective and their perspective, what needs to happen in the recovery process, and so they can better anticipate future needs or future issues with the patient.
The last question is exactly the opposite of that question, and that is from a doctor's standpoint, and there are a lot of doctors who attend the Workers' Compensation Educational Conference. What do they get, and what should they want to get out of attending a conference that is mostly a claims conference?
Sure. Well, I think everything I've learned from workers' compensation has come from after my training, and that's been on the job pretty much. And I think the things we're not taught in medical school are getting patients back to work faster, working with nurse case managers, adjusters to understand restrictions, impairment ratings, and I think it just offers another chance for a physician or another medical professional to kind of immerse themselves in that environment to understand the other side of the coin and what you and other people do in the workers' compensation industry.
Thanks, Doctor. As usual, these are fascinating and just as educational for me as everybody else. Don't forget the dates of the convention are August 6th through 9th. It's at the Orlando World Marriott Center. For more information about the convention and our social media platforms, see our website at WCI360.com. That's all for today. I'll see you in August.